This is the last part of our non-fermenting and some miscellaneous gram-negative rods. And we're going to conclude with the miscellaneous gram-negative rods. And these are organisms that don't really fall into any of the categories that we've been talking about. So they're not Enterobacteriaceae members, and they don't really fall into the fermenting or the non-fermenting gram-negative rods. They are gram-negative rods. They're in their own little category, and the genera we're going to talk about are Campylobacter and Helicobacter. So the clinical features of Campylobacter are that they usually are involved in intestinal symptoms, diarrhea, abdominal cramping, not wanting to eat, possibly a fever. The organism Campylobacter jejuni is the most common cause of gastroenteritis worldwide. So Campylobacter jejuni causes more gastroenteritis than Salmonella or a lot of the other intestinal pathogens we've talked about. So it's very, very common infection. There are other Campylobacters like Campylobacter coli and Lari. Campylobacter fetus has been isolated from blood cultures in bacteremia, patients with bacteremia. Campylobacter fetus is rarely associated with gastrointestinal illness, unlike Campylobacter jejuni. Now, Helicobacter is another organism in this miscellaneous group, and the only species we're going to talk about is pylori, and Helicobacter pylori is the major cause of type B gastritis, and it has been associated with stomach ulcers. So we're going to start out talking about Campylobacter. So in general, this organism has a gull wing shape. It tends to have a little bit of a curve to it. Now you should be thinking, what organism that we've talked about has a curve to it? And one is Vibrio, is a curved gram-negative rod that can look like a comma. But Campylobacter, again, it can sort of be curved like a comma. It can be gull-winged. Now the key thing about Campylobacter is it is a microaerophilic to capnophilic organism. So it has to be grown under very specific atmospheric conditions. Unlike most of our bacteria we've talked about thus far, which are most of them are facultative, so they can grow in either an ambient air incubator or a CO2 incubator. These organisms have to be grown in a special way. These are oxidase positive, so they can be differentiated from our Enterobacteriaceae family members, and they usually require 48 hours of incubation in order for you to see visible colonies on agar media. So those associated with human disease, we already talked about some of these: Campylobacter fetus, Campylobacter jejuni. Campylobacter jejuni is going to be the most common organism that you would come across in a clinical setting. So it's the leading cause of gastroenteritis throughout the world. I mean, this causes the most gastroenteritis. The diarrheal disease begins with mild abdominal pain within 2 to 10 days after ingesting a contaminated food product. So I mentioned this previously with foodborne infections. It's so easy to think about if you start getting ill, abdominal cramps, diarrhea, what did I have for lunch? Or what did I have for dinner last night? It's very difficult to think about, what did I have a week ago? And with Campylobacter, it can take that long. I had Campylobacter very, very badly many years ago. I linked it to undercooked chicken that I had 5 days prior to getting any symptoms at all. So of course, I went to a dinner party and I got sick that night, and I thought there was something in the food at the dinner party. Started calling everybody up at this dinner party. No one else got sick. But then someone that I had dinner with 5 days before that dinner party, and we happened to both have chicken, and it was slightly undercooked, I think near the bone. Both of us got sick. So that was the cause of Campylobacter. So 5 days before. It causes severe cramping, bloody diarrhea, possibly fever and chills, and it has caused vomiting, although not as common as the diarrhea. Usually it's a self-limiting infection, and it can take 2 to 6 days. I was sick for at least 4 days when I had Campylobacter. Untreated patients can carry the organism for several months. Campylobacter fetus, we already said, is more frequently isolated from blood. Rarely is it associated with gastrointestinal disease, and it's more commonly a cause of bacteremia in elderly patients and immunocompromised individuals. The epidemiology of Campylobacter, it's a newer pathogen. It has been known to cause abortions in animals such as cows, sheep, and swine. Transmission can be direct through contact with infected animals, or indirect by consuming contaminated water, dairy products, and most commonly improperly cooked poultry. You can get person-to-person transmission, and most often the disease can occur in children less than 1 year of age and adults between 20 and 40 years of age. And that's the time period that I got sick. I think I was around 26 or 27 when I had this severe Campylobacter infection. I had to go to the emergency room and everything. So that's how I absolutely knew it was Campylobacter. They diagnosed it. So lab diagnosis, Campylobacter fetus, again, usually isolated from blood. Campylobacter jejuni is going to be isolated from stool. Usually it's going to be collected in a transport media such as Carey-Blair transport media. It's oxidase positive. It is a motile organism. And Campylobacter jejuni is positive for hippurate hydrolysis. Now, in order to grow Campylobacter, you need to use a highly enriched and selective media. So the most common media that you will use to grow Campylobacter in a clinical laboratory is a Campy blood agar plate. So Campylobacter does not grow well at all on your typical 5% sheep blood agar. You have to use a specific Campy blood agar plate. It looks identical to 5% sheep blood agar plate, which is why you really always want to look carefully before you inoculate your media to make sure you're using the right media. So Campy blood agar is a Brucella agar base that has 10% sheep red blood cells as well as antibiotics to reduce the growth of your normal intestinal flora to select for your Campylobacter. A media called Campy CVA suppresses the normal intestinal flora a little better than your Campy bloods. So any suspected specimen, so if you have a diarrheal specimen that comes in, you're going to inoculate it, depending on what laboratory you're in, on a specific set of media. So it's usually going to be your blood agar, so you could do your oxidase and indole testing, McConkey, so you can select for your gram-negative rods, because that's going to be the most usually the cause of your intestinal illnesses. You are going to use a highly selective media such as hectoenteric or XLD, and you are usually going to also inoculate a Campy blood plate. Now, Campylobacter, Campy jejuni, the optimal growth of this organism is much higher. It's 42 degrees Celsius instead of the 35 to 37 degrees Celsius that most microbiology incubators are set at. So that will allow you to differentiate Campylobacter jejuni from Campylobacter fetus. Campylobacter jejuni grows at 42 degrees. Campylobacter fetus will not grow at 42 degrees. Campylobacter jejuni optimally grows at 42 degrees, and some laboratories will have a specific incubator set at 42 degrees for Campylobacter jejuni. It will grow at 37 degrees though, or in the 35 to 37 degree incubators. It just might take a little bit longer for the colonies to come up. Now, how you incubate your Campy blood media after you inoculate it. And in most labs, they use what's called a Campy pack, and it looks like this. It's a little pouch that can fit 2 different plates. You inoculate your plates, you make sure that they're nicely labeled, you stick your plates in this pouch. The pouch has a little slot along the top, and each pouch comes with a little container of liquid. You pop open the top of the little liquid ampule, and you squirt the liquid into this little sachet that's in the top of that pouch. You then seal it up. It comes with a little plastic sealer so that no oxygen is getting in, and your environment is going to remain in that pouch. And you're going to stick the pouch in your incubator. If you have a 42 degree incubator in the lab, great, you stick it in your Campy 42 degree incubator. That little pouch is going to generate a microaerophilic environment. So those plates are going to be sitting in a microaerophilic, a low oxygen environment that's perfect for Campylobacter, and you are going to incubate for 2 days before you open that pouch and look at your plates. Now, for colony morphology, Campylobacter jejuni are moist, runny looking. They tend to spread, so it almost looks like there was too much water on the plate and it moved the organism from one side of the plate to the other. Usually they're non-hemolytic. Campylobacter fetus produces smooth, convex, translucent colonies. They tend to have either a tannish or a slight pink coloration. And here is Campylobacter on your Campy blood agar plate, and you can see that slight kind of a pink hue to it, but it's very subtle. Microscopically, Campylobacter are curved gram-negative rods. They are non-spore formers. They can have a spiral or S-shaped or seagull or gull-winged shaped if you gram stain an enteric specimen. They do stain very poorly, so instead of using safranin as a counter stain, it's recommended that you use the stain carbofuchsin. If you do use a typical gram stain where safranin is the counter stain, you should counter stain it longer, so for at least 2 to 3 minutes. If you do a hanging drop motility test, and I don't know if some of you did this in general microbiology, I used to do this test when I taught general microbiology, you will see a darting motility. So the organism will move in one direction and then dart in another direction and dart in another direction. So here's a gram stained smear from colonies on blood agar media showing your gram negative rods, and you could sometimes see, that seagull wing shape or a slightly S or spirally shape that would be suggestive of Campylobacter. Again, another Campylobacter gram stain, but very difficult to differentiate one gram negative from another. So with Campylobacter, you would have An individual, usually in the specific age range, the less than 1 or between 20 and 40, who's had diarrhea for several days, and you're going to have normal. We're going to move on to Helicobacter. So there are several species of Helicobacter, but the only one that we're going to discuss is Helicobacter pylori. And this organism has been linked to gastric infections. And once an individual gets infected with Helicobacter pylori, that organism can remain in the stomach for a very long time, causing inflammation. So Helicobacter pylori doesn't actually invade the gastric epithelium, but it generates an immune response by the infected individual, which leads to inflammation. So antibodies are not protective. So you can actually, even if you were treated and you got rid of your Helicobacter pylori, you can get it again. It's the major cause of type B gastritis. There has been an association with peptic ulcers, the cause of peptic ulcers, although there are many people who have peptic ulcers that do not have Helicobacter pylori. So it's not definite that someone who has an ulcer has Helicobacter pylori. There are people who have Helicobacter pylori that never get an ulcer too. Long-term Helicobacter pylori infection has been associated with gastric cancer. In the laboratory, commonly these organisms will be isolated from gastric biopsy material. So if someone gets scoped and they have an inflammatory process or an abnormality in the stomach, and a biopsy will be taken. It should be transported to the laboratory very quickly in Stewart's transport media. And microscopically, Helicobacter looks very similar to Campylobacter, of a curved gram-negative rod. Usually, in order to be diagnosed with Helicobacter, you don't have to have a biopsy. So let's just say you went into your doctor's and you said, oh, I'm having, a lot of acid in my stomach and feel like I have an ulcer, or a physician thinks you might have an ulcer. They're going to order an ELISA test for Helicobacter pylori. So it's just going to be draw your blood, send your blood in, and your serum is going to be used to look for antibodies against Helicobacter pylori using an ELISA test. So I used to do a ton of ELISAs when I worked in a clinical hematology laboratory, and Helicobacter pylori was one of the tests that I used to do. You can do in your gastric biopsy samples, you can, do gram staining on them. They can be histologically cut and looked at. Now the thing about Helicobacter pylori is it's a very strong urease producer. So we already showed urea media, that the media can be a broth or an agar. It's called Christensen's urea media. And if you inoculate Helicobacter in your urea media and then incubate at 37 degrees, you will have a bright pink color within 2 hours. So it produces a ton of urease in a very short period of time. There's also something called the urea breath test. So this organism produces so much urease that you can actually do a test to diagnose if someone has Helicobacter pylori by doing this breath test, where you breathe into this testing apparatus and it will measure the amount of urease present, and it's an indication that an individual might have Helicobacter pylori. But the most common diagnostic test for Helicobacter is definitely the ELISA test. So here you have Helicobacter pylori, On the left, you see the gram-negative curved and gull wing shaped rods. And on the right, this is a Giemsa stain of a stomach biopsy. And because it's Giemsa stain, it's not going to be pink like a typical gram-negative bacteria. So Giemsa is a purplish blue stain, and it's going to stain those nice curved organisms in the stomach, which are Helicobacter. So here is a flow chart, and honestly, I would not recommend memorizing every single solitary organism on this flow chart. This flow chart is huge. There are a ton of organisms. I think what's important here is to know Helicobacter and Campylobacter because they're a little different, so know those two organisms. Then out of all of the other organisms, know that they're non-fermenters, which means that they will be K over K or alkaline over alkaline on triple sugar iron agar. You should know how they differ, or how you would differentiate them from your Enterobacteriaceae, your Vibrio, Aeromonas, or Plesiomonas. So how do you differentiate the various gram-negative rods from one another? So that's what's really important. If there's some key reaction in this group that differentiates it, like most of them are oxidase positive, but if one is oxidase negative, you might want to commit that to memory, or those that don't grow on MacConkey agar, because most of your gram-negative rods will grow on MacConkey agar, except for the fastidious gram-negative rods that we talked about earlier on. So again, just know the bigger things and how you can identify one from another. And here's another chart showing positive and negative reactions for various types of tests that would be done in a clinical laboratory. Again, I would not memorize this slide right here. I think if you look at oxidase, almost all of these non-fermenting organisms are oxidase positive. So you might want to look, Stenotrophomonas is oxidase negative, and Acinetobacter is oxidase negative. You should know that those organisms are oxidase negative, and how you would differentiate them from an Enterobacteriaceae organism. I mean, you should definitely know that Pseudomonas aeruginosa produces pyocyanin, and so some of the key reactions you should know, Helicobacter pylori produces a ton of urease, so it would be urea positive. Those types of things you should know. The Shewanella putrefaciens is an H2S producer. None of these other organisms are H2S producers. So how would you differentiate Shewanella in a little case study, or in a question on your next exam or on the final exam? How would you differentiate Shewanella from a Salmonella? Salmonella is another H2S producing gram-negative rod. Well, one key thing is the oxidase, right? Salmonella is oxidase negative, Shewanella is oxidase positive. So this is how you have to start thinking. This little table also shows you which organisms don't grow on MacConkey. So most of these non-fermenting gram-negative rods will grow on MacConkey, just like your fermentative gram-negative rods grow on MacConkey, except for your fastidious organisms. So I would look and see, is there any key organism that doesn't grow on MacConkey? Most of them will grow on MacConkey agar. So that's except for your Moraxella organisms. So we already talked about Moraxella. Some do and some don't. So you should know the key ones. Most of the big Moraxellas do not grow on MacConkey. So that's a key feature about Moraxella. Here's another little flow chart, very simplified flow chart. If you had an indole positive organism that's fermentative that can grow in salt, you're probably thinking of Vibrionaceae member. So this is similar to the chart that was on the last lecture of the fermentative gram-negative rods, but this chart has your Campylobacter and your Helicobacter in it. So Campylobacter and Helicobacter are not in the non-fermentative gram-negative group. They were just added as miscellaneous gram-negative rods because they don't really fit well in any category. Campylobacter and Helicobacter kind of fit in their own curved gram-negative rod category that are involved in intestinal disease, Helicobacter being stomach and Campylobacter being gastrointestinal. So this is the end of our non-fermentative gram-negative rod lecture. So lectures 5 through 8 will be covered on the next examination. Now keep in mind though, the final exam is cumulative, so you can't stop thinking about the organisms covered in weeks 1 through 4 because they will resurface on the final exam. So if you didn't memorize those lectures for the first exam, you need to have them memorized by the time the final comes around. For the second exam, make sure you have all of your flow charts, your key flow charts memorized for exam 2, and you can identify the differences between all of these gram-negative rods.